everyone. I'm Dr. Poorva Shah from Pune, and welcome to this session on microneedling. I'm excited to take you through what I call the intersection of art, anatomy, and emotional healing. Let's start with a simple truth. Acne scars don't just stay on the skin, they lodge themselves deep into the psyche. What we do with microneedling is not merely aesthetic, it's profoundly restorative. Over this lecture, we will understand the clinical and emotional impact of acne scarring, identify the scar types, and select appropriate microneedling depth and technique. Learn the science of collagen induction and its relevance to Indian skin. Evaluate the role of adjuncts like PRP, RF, and subcision in scar management. And counsel patients effectively on outcomes, care, and complicative prevention. Today's case features a 48-year-old female, Fitzpatrick type 3. Her acne began in her adolescence and progressed to nodulocystic lesions, now resolved. But what remains are deep, emotionally charged scars. She says, "I stopped making eye contact in my youth because I thought people were staring at my skin." And I quote her because it reminds us every scar we treat has a story. Ask the right questions here: the duration, the treatments that have been tried, the current routines, and the psychosocial impact. You are not just assessing the skin, you're decoding a journey. On examination, she presents with a mixed pattern: ice pick, rolling, and box scars. Now remember, ice pick scars go deep and narrow. Rolling scars are shallow with sloping edges. Box scars have sharp edges with varying depths. There is minimal erythema and some PIH, but no active acne. That clears her for the procedure. Clinical photography with standardized lighting is mandatory. That's your roadmap and your legal documentation. She's tried the basics: topical retinoid, benzoyl peroxide, and a few chemical peels. Peels may help PIH, but they don't remodel the dermis. Her outcome was suboptimal. Here's your clinical pearl. Therapeutic escalation is often missed. Patients plateau on the basics and then lose faith. You need to guide them from routine to regenerative. Acne scar treatment is a puzzle. Each modality, lasers, peels, PRP, subcision, is a piece. Microneedling is unique because it's cost-effective, minimally invasive, very importantly safe for Indian skin types with regards to PIH, does not rely on heat. It is collagen induction without ablating the epidermis, which makes it a very elegant procedure. What are we doing here? Mechanically, we create controlled micro-injuries that penetrate the stratum corneum. Biologically, this triggers a cascade: platelet aggregation, neutrophil influx, release of PDGF, TGF-beta, VEGF, fibroblast activation, which leads to the production of collagen 1 and 3. Unlike lasers, the epidermis is largely preserved. You stimulate without stripping. This is perfect for barrier-conscious protocols. Let's talk research. A 2023 randomized controlled trial in dermatologic surgery showed a 40 to 50% improvement in acne scarring after 3 to 6 sessions of microneedling. If you add PRP, you accelerate healing and boost texture gains. Microneedling also outperforms lasers for PIH risk, making it ideal for Fitzpatrick 4 to 6 skin. Always cite evidence. Your patients will thank you. Now here is a spider chart comparing microneedling, lasers, peels and TCA across 5 parameters: safety, PIH risk, downtime, cost and efficacy. Microneedling holds the sweet spot. Balanced performance across all domains. Lasers win on speed but risk PIH. Peels win on cost but not depth. So choose wisely. The technique is fairly simple. Cleanse the skin. Apply topical numbing cream for 30 to 45 minutes. Select your device. Adjust depth based on scar type and site, usually between 0.5 to 2.5 millimeters. Use vertical, horizontal and oblique strokes. Look for pinpoint bleeding. It is a marker of adequate dermal reach. Do not exceed 3 to 4 passes per zone for the fear of PIH. Typically 4 to 6 sessions spaced 4 to 6 weeks apart. This spacing allows for collagen remodeling and reduces inflammation. Results begin after session 2, peak around 3 to 6 months after the final session. Document everything. Progressive photos matter more than just adjectives. PRP amplifies the biological signal by delivering growth factors like EGF, VEGF and PDGF directly into the dermis. Exosomes are extracellular vesicles, carry microRNAs and proteins that promote regeneration. Think of them as messengers for healing, but more research is awaited. Topical or injected, both routes are effective. Cost, availability and patient preference will dictate your choice. PRP amplifies the biological signal by delivering growth factors like EGF, VEGF and PDGF directly into the dermis. Exosomes are extracellular vesicles which carry microRNAs and proteins that promote regeneration. Think of them as messengers for healing, but more research is awaited. Topical or injected, both routes are effective. Now, the cost, availability and patient preference will dictate your choice. RF microneedling is excellent for deep scars. The added heat tightens the dermis and enhances neocollagenesis. CO2 laser and microneedling can be alternated, never combined on the same day. Subcision plus microneedling, great for rolling scars. Polynucleotide injections help in hydration and refinement. Never do it all at once. Scar management is a series. Set expectations wisely. We promise improvement, not perfection. 20 to 30% better texture after 4 to 6 sessions is realistic. Patients notice smoother skin, less shadowing, more uniformity. Reinforce that improvement is structural, not just superficial. Here's what you can advise for post-procedure care. No washing for 6 to 8 hours. No sun actives or makeup for 48 hours. Use hyaluronic acid serums, barrier creams and mineral sunscreens. Redness and peeling are common, not alarming. Ice packs and peptides can soothe the inflammation. Always send written instructions. Do not leave it to memory. Complications are rare but not absent. Most common, PIH, persistent erythema, and transient acne. Infections are rare. Prevent with asepsis, depth control, and spacing. If something does go wrong, document it, treat it, and then follow up with the next session. The absolute contraindications are active acne, herpes flare-up, and keloidal tendencies. Severe eczema or psoriasis are also contraindications. The relative contraindications are anticoagulants, immunosuppression. Always take a pre-procedure consent. Dermatologists are not above medico-legal standards. Your patients will ask you, is it permanent? Collagen gains are long-lasting, but maintenance may be needed. Is it painful? Mild, manageable. Downtime, 2 to 3 days typically. Will I get pigmentation? Rare with proper depth and good post-care. Reassure, educate, and empower. To conclude, microneedling is safe, versatile, and scientifically validated. It synergizes well with PRP, RF, and PN. Success lies in patient selection, counseling, technique, and documentation. Empower your patients with honesty. Empower yourself with knowledge, skill, and humility. Thank you.